Hey everybody, Dr. Matt Symons from Palm Beach Health Center. We're here today to talk about vertigo. Vertigo is that dizzying thing when you feel like you can't see straight, you can't move straight, and when you get up from either sitting down or laying down or moving the wrong way, all of a sudden either you start spinning or the room starts spinning. And I'm here to talk about what are some of the causes of it, as well as what things you can do to fix it. So one of the first causes of the feeling of vertigo is it might not even be vertigo, it could be a blood pressure problem. So if you have a low blood pressure, where it's something called orthostatic hypotension, which is a big fancy way of saying when you change from one position to another, your blood pressure might not make it up to your brain quickly enough, giving you the sensation of dizziness. Now, while this isn't true vertigo, there are things for this as well. Oftentimes you can change your nutrition a little bit to make sure that your blood vessels dilate or open up fast enough so you can stand up. There are things that you can do to make sure that your vascular system is healthier than it is. The other thing that it could be is misalignments of the upper cervical spine. See, the top two bones in the spine can move out of alignment and put pressure on the lower brainstem, upper spinal cord, and cause the inability for your brain to recognize where up and down in terms of spatial relationships are. But the most common is something called benign positional vertigo. And in benign positional vertigo, it has to do with your metabolism not breaking down proteins properly. So what ends up happening is you have little uric acid crystals, kind of like with gout, that end up going inside the inner ear. And inside the inner ear, there's little hairs called cilia that tell you where up and down and left and right is. That's how you have balance inside your inner ear. And kind of like that game we played when we were little kids where you had a BB in the little maze and you try to get in the center, if those uric acid crystals hit the cilia, it can throw you off. So one of the best things you can do in that situation is A, change your diet so you're not creating any more uric acid crystals, and two is if the ones that are on there already, you can get them off by using a more sophisticated Epley maneuver. Now the Epley maneuver was created to get the crystals off, but it can be very not effective for some people. And so there was something called a Vertigon that was created that helps individualize the Epley maneuver for every single person, right? You can put this device on your head and actually go through a series of about 5 or 6 moves and get those crystals off. And then, of course, we would talk to you about changing your nutrition to reduce the metabolic uric acid crystals that are being caused there in the first place so that you don't get them anymore. And so that's been my vertigo solution for a lot of my patients who've gotten great results. If you or someone you know is suffering from vertigo, then make sure that you send them this video and then send them our way. Palm Beach Health Center, Dr. Matt Symons, and we're here to keep you on your feet. Have a great day.